Hey guys, this is Dr. Ahmed Ergin. I'm an endocrinologist, and I'm going to talk to you today about why diabetics lose weight. I'm not saying why diabetics cannot lose weight. I'm saying why diabetics lose weight. And I'm going to tell you about why they lose weight with or without medication. Sometimes you'll lose weight if you're on certain medications, which I will talk about that as well, but I'll talk about why are you losing weight when you have diabetes. That's today's topic. Let's get started. All right, so before we start this video, make sure you subscribe, make sure you share this video so you can help us grow and we can bring you more videos. Now, most of the time, patient with type 1 or type 2 diabetic will lose weight because of insulin deficiency. Now, you're going to say, type 1 diabetics are insulin deficient, aren't they? What about type 2 diabetics? Are they insulin deficient? Yes, they are, sometimes. Now, as you can imagine, I'll tell you why not having insulin in your system will cause weight loss. And I'll tell you why type 2 diabetics can also be extremely insulin deficient as well. So, insulin deficiency happens when your pancreas totally fails, which means that there is almost no insulin coming out of your body, or very little. So, it comes from beta cells, right? So beta cells in pancreas make insulin. Now, in type 1 diabetes, that will fail. In type 2 diabetics, that will fail to a great extent. Now, insulin is the ultimate metabolic anabolic hormone. So insulin makes things grow. Insulin makes you gain weight. Knowing that, if you do not have any insulin in your body, you know that you will lose weight. How? Now, if there is no insulin in your body, what happens? Your blood sugar goes up, correct? Very easy. You may have insulin in your body, your sugar may still go up if you're insulin resistant. But in this case, I'm talking about insulin deficiency only. Now, your blood sugar will go up. Now, when your blood sugar goes up, what happens? Your kidneys normally, in normal people, your kidney will start absorbing blood sugar anytime your blood sugar is about 180. Okay? Now, in diabetics, that's a little bit higher, maybe after 220. But after 220, you're pretty much on your own, because after 220, your kidneys will be like, I don't know what to do, man, that's way too high. And your kidneys will be like, I'm out of here. And then your blood sugars are going to be going all the way down to your bladder, because your kidney is not going to be able to absorb what is passing through, and then you're going to end up peeing. So as a result, patients with diabetes who have uncontrolled diabetes that are about 220 blood sugar, chronically or most of the time, they will end up having a lot of weight loss and a lot of excessive urination. Because when you pee the sugar will attract water. You cannot just pee crystallized sugar, right? So in order to be able to urinate sugar, your kidneys will let more water go down. So you're going to be constantly thirsty as well for that reason. So constant urination, constant thirst will be together with weight loss, or will bring the weight loss with it, just because you're losing a lot of sugar. Now, I call this wasting. So you're basically wasting. So if your body is wasting sugar all the time, your body will start running on fat and protein. And of course, you're going to go into ketotic state, and it's going to be like almost unofficial or unintended ketogenic diet type of situation. But your blood sugars will be running high compared to keto diet, which is not the case here. Your blood sugars will be running high, damaging your organs and damaging your pancreas even more. It's a disaster. So it's like a flooding in a neighborhood where you cannot really do anything and things only get worse if rain doesn't stop, right? So that's why people lose weight when they're insulin deficient. Now, this is common in type 1 diabetes. So why type 2 diabetics become insulin deficient? So here's why. Normally, when you have type 2 diabetes, your body will try to make insulin for a long time. It's called insulin resistance. Will try to, your blood sugar will stay normal. Okay, that's your blood sugar. Let's say I'm going to call this a 90 to 100 level. But your insulin level in time will keep going up just like this to maintain your blood sugar still in the normal range. At some point, because of the stress, too much stress, or working too much, or burning out, whatever you call it, just like human beings, these poor cells will stop making the insulin and it will start going down. Now, the insulin goes up because of the demand. It's like if you start spending more and more money, if you start buying more and more things, if you start getting more and more loans, then you're going to have a lot of debt, right? This is like a debt going up. You have to pay for this. So if your body needs that much insulin because you grew your body so much, then once your insulin levels go down, like your income in this case, I'm just making an analogy, your income goes down, you suddenly will tell yourself, oh, what did I do? Like now, it is very hard to get out of $1 million house. It is very hard to sell your car. It's all depreciated, and now you're pretty much in a bad shape, okay? Now, and at that point, when your insulin starts going down, then your sugar starts going up. Now, what happens here is your insulin is going down, your sugar is going up. At that point, you need to really intervene. That is a breaking point right here. Right here, your insulin starts going down, your sugar starts going up. If you don't do something very aggressive here with lifestyle changes or a medication or both, you will be in trouble very quickly. Then what's going to end up happening is just like how the debt end up accumulating very quickly, and then the interest, and then you suddenly feel like you're drowning. Same thing for your body. Eventually, your sugar will be so high that this high blood sugars will actually kill your pancreas, your beta cells, more and more. So if you have 20% of your beta cells left, if you let your blood sugars remain high, eventually you will have no beta cells left from high blood sugars. And that can happen very quickly. If you're not really measuring your blood sugar, you may go from 6% A1C to 16% A1C within 3 months. I see that all the time. People come to me and they say, my A1C was 6% a couple months ago. What happened to me? 16%, because you got into what we call a crisis. It's called glucotoxicity. Glucotoxicity means that your glucose starts going up and becomes toxic to your pancreas, will totally paralyze your pancreas, your beta cells. Your beta cells will become unresponsive. They may not be totally dead, but they will be paralyzed. Unless you bring your blood sugars down very quickly, those beta cells are not going to do anything. Even if you start eating well for a while, these beta cells will stay paralyzed. And then that causes insulin deficiency, and then suddenly those type 2 diabetic patients start losing weight, start being excessively thirsty, excessive urination, they go to the doctor, they get diagnosed with diabetes. If they change their lifestyle and they start on a medication, they may quickly recover, and then their beta cells, their beta cells will start recovering. Now, the misconception is, and I get this question a lot, and these people actually asked that question recently, my A1C was high, now it's almost to normal, back to normal, am I cured? No, you're not cured, unfortunately, because you're too late. By the time you get diabetes diagnosis, you only have like 20% of your beta cells left, 20-30% max. Now, when your A1C is really high, as I said, your beta cells were paralyzed. Now those 20%, you regained the 20% of the beta cells, okay? The 20% of the beta cells that were drowning are back. But you only got back 20% of these beta cells. Now remember, as we get older, everything in our body gets older. So if you're prone to diabetes and you only had 20% of your beta cells left, that means that yes, you're in remission for now, but you have to really watch out for another episode coming in. So because if you ignore it, again, your blood sugar may start creeping up, and the next thing you know, your beta cells are in a failure again. It's like economical crisis. Just because you got out of an economical crisis, that doesn't mean that you're good for forever. you still have to watch your economy to make sure that you don't go into another crisis or bankrupt, right? That is the main reason why people with diabetes lose weight. Other than that, some medications will cause weight loss as well. So, and if the doctor didn't tell you, you will not know why you're losing so much weight. So, metformin can cause around, 2 to 3% weight loss. So you should know that. Another common class is GLP-1. GLP-1s can cause a lot of weight loss. I have seen people losing up to 80 pounds of weight loss, and sometimes blows my mind. I mean, how did you lose 80 pounds? Sometimes, I actually had a patient with 100 pounds, but it's an exception. Most people will lose at least 5 to 10 pounds on these GLP-1 drugs. And these are Rybelsus, Ozempic, Trulicity, Bydureon, etc. Bydureon is not that strong, but I think the strongest one for weight loss in my practice, in my experience, is Ozempic. Studies also show that as well. And then the Rybelsus, and then Trulicity, and so forth. Now, the SGLT2 class, which is your Jardians, your Farxiga, Invokana, etc., they also cause significant weight loss. Not as much as GLP-1, but people can also lose a lot of weight. But there's a limit with those. I'm not seeing really people losing more than 15, 20 pounds on these, but still, they can cause weight loss. So if you started these and you didn't know that they can cause weight loss, now you know. All right. I think that's pretty much it. So if you guys want to share your experience, want to comment, please be sensitive, please be open. You can share your experience, you can ask questions. We cannot directly treat you, but I can briefly answer you if I can, and I don't want to mislead you, because sometimes short answer is not the best answer. But make sure you share this video, make sure you subscribe, and we'll see you in the next video.